Every shift is different. Every patient matters. Every role has a story. This is a day in the life of a nursing associate. In this series, we'll be following nursing associates across the UK. Each episode takes us inside their working day, in hospitals, GP surgeries, care homes and community teams. You see how they deliver care, support patients and work as part of the multidisciplinary teams. You hear what inspires them to join the profession and what it really means to make a difference. This is their story. This is a day in the life of a nursing associate. Hello, today we're at the Heathlands Village, part of the Fed in the Great Manchester, a specialist care setting supporting older adults, including those living with dementia and mental health conditions. We're here today at the Federation of Jewish Services to meet with Ashleigh Duffy, a senior care manager and registered nursing associate. Ashleigh has started her career over 11 years ago and has since worked her way through the ranks, recently combining her leadership role with a clinical qualification through the nursing associate programme. She's passionate about delivering excellence end-of-life care and supporting residents and families through some of the most important moments. Today we'll be finding out what a day in the life really looks like and what the NA role brings to social care.
Hello, I'm Ashleigh Duffy and I'm a Senior Care Manager and Nursing Associate for the Fed.
So can you tell us a bit about how you started at the Fed over 11 years ago?
I started as a social care worker and I then progressed to a shift leader, then on to being a team leader, managing the unit, and then I progressed again to the senior team leader. After that, I then undertook the Nursing Associate course.
So what was the turning point that kind of made you want to move from care into kind of the clinical work?
I'd always had an interest in the clinical side of care, but didn't have the qualifications to go any further with it. So when I was offered the opportunity, I grabbed it, really.
And how did you kind of feel about going back into education to train as a nursing associate?
It was really daunting.
Yeah.
I was probably 10, 15 years out of education, so it was very strange to go back to a scheduled timetable, having to study, writing essays.
Back to homework. Back
to homework, yes, that was a big change. But I had a great support network around me, which made it a lot easier for me. So you've worked your way through so many roles, so what has been the most kind of rewarding step for you? Definitely gaining this qualification. Not only has it given me more skills and knowledge, it helps me to support more people across the site, which ultimately is the reason that I got into this job, is to care and support people, but not only the residents, my colleagues as well.
How has the kind of nursing qualification shaped your career as a senior care manager?
I think it's given me more confidence to support and advise my colleagues across the site, especially in the residential areas, and it takes a little bit of pressure off our clinical team as well to have that extra support to support the other areas across the site as well.
So what does a kind of typical day look like for you as a senior care manager and an RNA?
Every day is very, very different. So I would normally start my day with going and seeing all of the units, checking all the residents have been okay overnight, checking in with the staff. I would oversee the rotas for the rest of the week, check the site's safe, check up on care plans, any audits that need doing, and then anything that comes through as and when, be it resident concern, staff concern, I would deal with that as well.
God, it sounds very, very busy. So how do you kind of balance management responsibilities with the clinical care?
I think we've got a really good team and support network here, so we've got a good supply of managers and clinical staff that are always on site at the same time. So it's quite easy to support it if you're organised.
So what kind of clinical tasks do you still get hands-on with?
Well, sometimes if we've got nurses on annual leave, I will cover the nursing shifts. So that's everything from medication, personal care, injections, peg feeds, dressings. We get quite a lot of different skills that we can get our hands on in here as well.
One of the things you mentioned to myself is that you're very passionate about end-of-life care. So what does it mean to do that work well?
I think for me, end-of-life care, it's the last memories that you've got with your loved one, and for me to make that a peaceful experience for the individual and for the relatives is really important. It's about making everybody comfortable and ensuring that, as awful as this time is for people, that they don't think back on this time with awful memories of poor care, poor pain management, anything like that, that it's as nice an experience as it can be for everybody involved.
And how do you support family members and residents going through such emotional change in times?
I think it varies from person to person, really. I very much take the lead from them. Some people obviously require a lot more support, a lot more information than others. So I will just always do my best to provide them with that information, point them in the right direction of services that can support them as well, other than ourselves, and just try and generally make sure that it can be as peaceful an experience for them as possible.
My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with a lot of experience. My name's Karen Johnson. I'm the Clinical Director at the Federation of Jewish Services. I've worked here for 15 years. My background is nursing, midwifery, school nursing, so I come with...
Ashleigh has stepped into a leadership role as a senior care manager and RNA. How does she balance the kind of clinical with the operational?
So she switches quite often when she has to cover a nursing shift and then revert back into her senior management role. She manages that very well, actually. She probably wouldn't say she did, but I can see that she does. So because she fluctuates from maybe doing 2 nursing shifts if somebody's on leave, and then the rest of the week she'll pick up on her management duties, which still remain very robust. She doesn't miss anything, so she manages very well, I feel.
She's very passionate about end-of-life care, and how do you see that reflected in her day-to-day work?
I know if Ashleigh's running the shift and if we've got people at end of life, I don't have to worry. I know she's competent, confident. She can set a syringe driver up with support. I never have to think, how will she be? Will things be okay? Because I have that confidence in her.
How has having someone like Ashleigh with both management and clinical expertise shaped your kind of team operates?
It's a little bit like icing on the cake, I would say. We're getting more from Ashleigh in the respect of from the clinical side, but equally with her managerial skills, she manages to apply the managerial to the nursing side as well and comes up with some extremely good ideas that even I haven't thought about, but she thinks more out of the box. So I think they complement each other.
Do you think the NA role helps keep expertise staff in social care rather than losing them to kind of hospitals or agency work?
I would like to think so. We've got 2 qualified nurse associates. Neither of them have given any indication that they want to move to the NHS or go anywhere else. Our nurse associate in training, equally, I don't see her moving anywhere else other than working here. So I think we've got them for a long time, hopefully.
Looking at Ashleigh's journey, what does it say about what's possible in this sector when people are given the chance?
It shows it's possible in the care sector. It's not just NHS focused. I know sometimes throughout the choosing spoke placements for students, it does seem to be a little heavily NHS weighted, but equally we have people from the NHS coming here for spokes, and they're quite bowled over by the experience that they get here. I think with the work that we've been doing with Salford University recently with the interprofessional education, we have more people from different disciplines coming through here to work as students, and every single one of them has said what an amazing sector to work in. It's so different than the NHS, it's more person-centred. They feel they get to know people better than just on a busy NHS ward, and they have a great experience here.
Have you dealt with people understanding the nursing associate role?
We've had meetings with our nursing team, involved the nurse associates in that, showing them the code of practice that they have to follow, which is not dissimilar to the guidelines for a registered general nurse. We've explained when a nurse associate is in the building that a general nurse needs to be around, but to give that support. And they've all the nurses understand that now. They didn't really have any difficulty with it in the first place, to be honest. So I think they absolutely love having them here because they're giving them that extra support as well during the shift.
This episode is supported by Healthcare Conferences UK. Improve your practice, build your skills. Events designed for real frontline teams. Practical learning you can use the next day. Book your next conference today. What do you think people still get wrong or misunderstood about the nursing associates?
I think there's a misconception that we're overpaid carers, underpaid nurses, whereas really we've got the skills from both. I think because it's still a very new role, a lot of people aren't too sure on what we can do. So obviously we haven't quite got the skills of the nurses, but that doesn't mean that we can't support the nurses when they are undertaking those tasks. But we can also still get hands-on with the care staff on the units and the floors and support them. So we're actually really well equipped to support across the board, really.
Why do you think the RNA role is especially important in the social care setting?
I think there's a lot of pressure in social care for the care staff, the nurses. It's massively underfunded, so to be able to have somebody that can bridge the gap between the two and support across the board is really beneficial to everybody, especially here across the site because we're so large. To be able to do different roles in my job depending on what the site needs on that day is really beneficial.
And how has your kind of team reacted to you stepping into a more clinical role?
They've all been really, really supportive, yeah, and you know, we still work collaboratively together. Because I'm obviously not based directly on units, these staff still know the residents far better than I do, so between us, it works really well as a team.
So how can more care homes support staff to develop through the NA route?
I think they've got to trust that it is a good route to go down, because obviously it is still so new. We don't really have that much information on the impact that we're having. So I would just say to them, just try it. It really is helpful. It's beneficial for the staff and the residents as well.
What do you wish more people knew about the nursing associate qualification?
It's not as hard as people think it is if you've got the right team around you. It's very daunting to go back to university and to take up clinical skills, but if you've got a good team around you and a good support network of mentors, it makes it a lot easier to undertake that task.
What doors has this role opened for you professionally?
I think it's opened many doors. I could continue my career as a nursing associate in any field of nursing that I chose to go into. I could progress my career to be a registered general nurse. At the moment, I'm very happy in my role as I am as an RNA, but there's definitely different options if I was to wanting to develop further.
If someone is watching this and thinking about applying for the course, what would you say to them?
Do it. You'll feel 1,000 times better once it's over, because it is a hard course to undertake, but the skills that you learn from it and the doors that it opens and the work that you can do at the end of it is invaluable.
So my final question, well, penultimate one, is what's next for you?
I don't know at this moment in time. As I said, I'm very, very happy in my role here. I love my Fed family here. The residents are all amazing. I'm very comfortable where I am at this moment in time. I'll never say never that I won't go back to university, because when I did my previous qualification, I said that was it, and here I am. But at this moment in time, I'm staying as an RNA.
So my last question, which has nothing to do with nursing associates, but for every guest that I have, even on my podcast, I always get them to request a song that we can add to our NA and RNA playlist. So what song could we put on our playlist for you?
The first one that's come to my head, I think is quite poignant as well with the recent passing of Ozzy Osbourne, would be Crazy Train, because that's sometimes how I feel in work, that I am on a crazy train, but I love it.
That's amazing. Thank you ever so much.
Thank you.